Hey, yeah, it's Jenny. After 9 years after my brain injury, I'm still learning an awful lot about brain injury. Bear with me. This one's really important. I found this out and it blew me away. Every brain injury is an acquired brain injury or an ABI. It means you acquired a brain injury. It doesn't matter how you got it, you acquired your brain injury. So every brain injury out there is inclusive. We are all ABI survivors, regardless of how it came about. That really blew me away. When I saw that post about that, I was like, oh, I got to do more. I got to do research. And then it has subsets or two splits off from there. And what in the two subsets are non-traumatic brain injuries and traumatic brain injuries, meaning some brain injuries are caused by non-trauma and some are acquired by trauma. Non-traumatic brain injuries are caused by usually the following: anoxia, which is lack of oxygen, infections of some sort. Strokes are non-traumatic brain injuries are acquired by non-trauma events. Tumors, they're slow growing and they eventually cause the injury. Metabolic disorders, these are considered medically. Now, mind you, medically, physically, are considered non-traumatic brain injuries. They fall under the main headline of being labeled ABIs. The other subset under ABI of acquired brain injury are traumatic brain injuries caused or brought about or acquired by a trauma. Again, labeled. And there are two subsets to that. I'm having to read because I'm still trying to learn this, y'all. The two subsets are open penetrating injuries or closed internal pressure and shearing injuries. The open are caused by assault of some sort, falls, accidents, abuse, or surgery. The closed internal pressure and shearing are caused by assaults, falls, accidents, and abuse. Doesn't matter what kind, but those are how they are labeled. And the reason they are labeled is medically, not to be able to call us names or anything like that, but they medically label our charts by this so they know who to go to for medical follow-up, emergency care, that kind of thing, and documentation for our reimbursement and for us to get our support for our living for the government. And it starts out with all brain injuries are acquired brain injuries, and that means inclusive. All brain injuries are inclusive, not exclusive. No brain injury is this kind or that kind. All brain injuries are acquired somehow. And a brain injury, regardless of whether it's acquired by a trauma or by a non-traumatic natural event in the body, physically, is emotionally traumatic to every survivor. That I do know. That I do know. I do know. For every survivor, it is a traumatic event. But the labels that they give is just that. It's just a medical label. I myself, being a ABI, subset TBI, further subset, enclosed internal pressure or shearing survivor, I only ever now use the fact that I'm a TBI survivor when I'm absolutely have to am questioned by somebody, what kind of a brain injury survivor are you? Or if I'm at a medical professional where I have to tell them what, I'm a TBI survivor. Otherwise, I'm just a brain injury survivor. It doesn't matter because we're all survivors. We're all brain injury survivors. That's all that matters. I just wanted to share that because I'm still 9 years out and I'm still finding this stuff out. And it's just like, whoa, I don't know the difference. But all that matters is inclusive. We all are included. Inclusive, not exclusive. Hugs, y'all. Later, Gators.